Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, I'm speaking with Dr. Beth Resnick, Assistant Dean for Public Health Practice and Training at the Bloomberg School and co-founder of the STOP Partner Group, and Dr. Nilesh Kalyanaraman, Anne Arundel County's health officer here in Maryland. We speak about the aggression and anger aimed at public health officials during the COVID-19 pandemic, how some states have restricted their authority, and why urgent action is needed to restore public health now before the next crisis. You can learn more about STOP at standwithpublichealth.jhsph.edu. That's standwithpublichealth.jhsph.edu. Let's listen. Dr. Beth Resnick and Dr. Nilesh Kalyanaraman, thank you so much for joining us today on Public Health on Call. I've watched some of the videos of vitriol from citizens towards public health officials about policies like mask mandates and closures, and they're really scary. You can see this level of fury and aggression that's truly frightening. Let's start with you, Dr. Resnick. Can you talk about some of the violence that public health officials have had to face in the workplace and even at their private homes?
Yeah, thank you for being here. Yeah, it is quite terrorizing and frightening, as you said. And it's been happening across the country. Unfortunately, many of our health department leaders and their staff have experienced threats to their jobs, their safety, and even their family members. Things that we've captured through our research: death threats, shots fired at people's homes, somebody run off the road. It's just a constant barrage, email messages and things. And the scariest part is that these threats have often come from their own community members, or some places there's been organized militias, and even the elected leaders themselves, which has been really quite frightening. One of the health officers from Kansas, Dr. Jennifer Bacani McKinney, I thought made a really great point in her testimony to Congress, said even though the virus is the enemy, the anger and frustration are often directed at the people trying to address the problem, the public health officials themselves.
And Dr. Kalyanaraman, can you tell us about your experiences with your staff and what has helped you sustain your work through the pandemic?
Yeah. So during the beginning of the pandemic, there was a strong sense of unity in the community, and our department was ready to respond. And it really helped to have that sense of unity, that we were all, as you noted, Beth, fighting a common enemy, the virus. We ran on adrenaline and goodwill for a long time, but it's been going on for over a year and a half. Our staff were tired, the hours piled up. But I think more importantly, there were more disagreements, that tension in the community. And that vitriol took a toll. That took a toll on us and our staff. We've had protests outside of our health department. We've had some of our staff harassed. As leadership, we responded quickly to support our staff, both internally but also publicly. And we really had strong and visible support from county leadership. And that's been really important, right? To set the tone and say, you know what, that's not acceptable. We may disagree, but harassment, anger is not properly directed towards health department staff.
Harassment in any workplace is not to be tolerated, but the public health workforce, as you're pointing out, is particularly vulnerable right now at a time when we need them the most. And if there aren't concerted efforts to protect the safety and well-being of this workforce that's, already tired, that's already stressed, what could happen if and really when the next public health crisis occurs?
So there will be another public health crisis. And what's really important is that we need support, both public support, but also financial support to really build that infrastructure of public health and keep it strong and robust. You can disagree with what we're doing, right? There are political implications to all of this, but there's a difference between disagreeing and vilifying public health for their actions. And I think that's really been the part that's been challenging. I think the other part is that, I think in public health, we're not used to being the target of this kind of vitriol. And so there's almost been a slowness of response to, well, once COVID's gone, it'll go away. But like you said, Lindsay, it's not okay for there to be harassment, regardless of how people are feeling, right? You can feel frustrated, put upon by COVID, but you don't get to take that anger out on public health staff. And I think it's really important at this moment to really lock that down and say, you know what, it's not okay. It's not okay in any situation. And when there is a next crisis, we're not going to allow that either.
Dr. Resnick?
Yeah, great points. And I think of this sort of as a three-pronged thing. And yes, the anger and vitriol, clearly it's a culture and a pushback against government. And I agree. I don't think it's only around COVID. So I think as a field of public health, we really need to think about this in a three-pronged approach. The first piece is clearly the threats and harassment just have to stop. And the protections for the workforce, as well as supports, right? Thinking about mental health support and how we can support them going forward. And as Nilesh mentioned, that we weren't prepared. So again, thinking about this, unfortunately, sort of situational awareness, anticipating this and how can we address it? So the stopping the threats, of course, is first. The second is public health has long been underfunded and neglected. This is not a new situation. So as I like to compare, my husband's in the fire department. You don't show up to a fire without a hose that doesn't work, right? We need people, we need supports, we need data systems. All of that became clear throughout this pandemic that if you don't have the basic tools that you need, you can't do your jobs, even though best effort, without the right equipment and data and information, we're sort of cut off at the knees to be able to use our own public health skills. And then the last prong is the public health authority, which again is in this fit of anger is being stripped away, which is very scary because that is an ultimate public health tool, right? Being able to quarantine people, contact tracing, vaccines. These have all been basic public health protections since even before our Constitution was written. So having the authority to be able to put the public health protections in place is extremely important. And this is a really dangerous thread that's happening because it will put us at risk. A lot of these rolled back of public health authority is for anything, not just COVID. So the next pandemic, the next communicable disease, public health won't be able to put these protections in place.
Dr. Resnick, you've also talked about the fact that, these states did pass laws during the pandemic that actually restricted the authority of state and local public health officials in terms of making these really critical decisions. And this is really troubling. You've talked about the fact that the virus doesn't stop at state borders. So can you elaborate a little bit on that?
Yeah, thank you, Lindsay. Super important point. And the New York Times, as of October, reported at least 32 states that had new laws passed to restrict public health enforcement or maybe outlaw mask mandates or vaccine mandates or contact tracing, social distancing, or other restrictions of churches or schools or businesses. So again, this is COVID specific that we're thinking about. But if these laws were rolled back in a more generic way for all public health protections, no matter what the illness is, we've really put ourselves at peril going forward. And as you said, right, it doesn't stop at a state line. So if your next door state doesn't have any protections in, that puts people at risk at other states. The disease does not stop at the border.
Dr. Kalyanaraman, I want to go back to your point about funding. You've been very outspoken about funding for public health programs during times of crisis, or really in general. Can you talk a little bit about what setbacks you've seen and what you think would need to happen to prevent those?
We saw most visibly in 2008 and 9 when the financial crisis occurred, we saw a sharp cutback in public health funding. And we're seeing some of the consequences of that now, where public health staff they don't have the level of staffing or the investment in infrastructure. One of the things that has come up a lot is data. Having data, sharing data across systems. We have not funded our data infrastructure systems, and that's made it really challenging. I can't tell you how many times I've been asked, so what's the data on this particular slice of the population? What's happening with them with their case rate, vaccination? We've got to dive across multiple data sets, really antiquated systems. It's going to take funding to do that, to invest in that. And I think our challenge is that it's hard to see the victories of public health. They sort of get tossed into the background, right? We think about our vaccination campaigns and all the discussion we have around COVID vaccine, right? But when we look at school age vaccinations, it is amazing when you look at historical data that there really is, we have virtually eliminated where we have adequate vaccination, a lot of these childhood diseases, right? But we take that for granted. And it's not that we shouldn't, but we should just recognize that it requires constant vigilance to do so. And it's not, it's not just happenstance that we don't have measles, mumps, rubella, diphtheria, tetanus, polio rampant throughout our society. And that's the same thing we're talking about with COVID. We don't want rampant COVID, right? But that's the kind of visibility and communications we need to do constantly to show our worth as well.
Yeah, we always joke about, public health is working when it's invisible, unfortunately. Dr. Reznik, you recently testified before the House Select Subcommittee on the Coronavirus Crisis in the House of Representatives, talking about upgrading public health infrastructure. People can find your full testimony online, but can you give us the summarized version of your testimony?
Yeah, absolutely. I think basically what we've just been talking about. So the three prongs about how can we stop the threats and harassment? How can we slow or stop the rollback of public health authority that we need? And then we need to fund the public health infrastructure, as Nilesh was saying. We need the data, we need the people, we need the equipment and technology to be able to do our jobs. And you're absolutely right, Nilesh, about all the successes that we've had. And nobody really appreciates that. So I think that's super important to think about going forward and making our case the value. That is one thing I do think COVID has brought. We're focused on that small minority, that's that angry vitriol. But on the other hand, there's a huge understanding of public health and why it's important, way more than we normally would have. And we've had a huge surge of interest in students, public health graduate students. We've had more students this year than ever in our history. The last 2 years, applications have been up across schools of public health all over the country, over 20%. So that's an exciting thought about our future and how we can move forward.
And we have this amazing audience of engaged listeners here at Public Health on Call as well. Tell us a little bit, Dr. Reznik, about the work you've been doing with the STOP Partner Group.
Yeah. And again, when we think about the awareness and things, there's been a huge upsurge of interest. In fact, I can't keep track of my emails every day with more people wanting to get involved. We've created the Stop Threats and Harassment Against the Public Health Workforce, STOP Partner Group. We've had lots of people jumping in, including the FBI, the CDC, different membership organizations, and lots of people at academics, schools of public health wanting to get involved and think about how can we support our public health workforce. And again, a lot of the things that we're talking about today, how can we move forward? So some specific things that our group is looking at is improving access to how do you access law enforcement? What do you do to protect yourselves? Again, giving our workforce some of that awareness, situational awareness, and supports of what resources might be needed. Legally, are there some model laws? Are there ways there? In Colorado, there was a law that was passed to actually protect public health workers. So enforcement issues around that. And a new direction that we're taking that we're very excited is a new center here at Johns Hopkins. It's a NIOSH-funded Center of Excellence, the Johns Hopkins Psychosocial, Organizational, and Environmental Total Worker Health Center. And it's really talked about supporting mental health. And we're thinking about doing trainings and modules for public health workers. And again, not just now for COVID, but going forward, that we need to make sure our workforce knows we care about them and support them and want to make sure that they feel comfortable and safe in their jobs and have the tools and equipment to be able to do their work. And again, I just want to thank all of the workers that have been doing such a great job throughout this pandemic and really appreciate them. I never thought of public health people as warriors, but I think now you really deserve that title. And Nilesh, thank you and your staff so much for all you've been doing.
And let's end with you, Dr. Kalyanaraman. Can you give us sort of what's the spirit on the day-to-day now that we're coming up on, close to 2 years of this? How's your staff doing? How are you feeling?
Yeah, no, our staff they're feeling tired. But I think that we are, first and foremost, our hearts are in this. This is what we do, right? We are prepared to care for our communities. And so it's been a mission of love. But that doesn't mean that we're not tired. We don't want greater support from our community. And I think it's important to remember that all public health staff, we're part of the communities that we care for as well. And I think that's probably been the hardest is to, as Beth noted, that kind of anger from the community we're a part of. And so we just want to remind everybody that, we are doing this and we're going to continue to do this. And the support that we've gotten has been fantastic. So I want to end on that bright note is that we have as much anger as there has been. We've also gotten a lot of support from the community, and that has really helped keep us going.
And what's, just to end on this, what is one thing that the community can do to support you in your work?
Go get your vaccine That's really important.
Dr. Beth Resnick and Dr. Nilesh Kalyanaraman, thank you so much for joining us today.
Thank you. It's been great. Thanks so much.
Thanks, Lindsay.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.